I'm kind of getting to the end of my work here, but I wanted to point out one thing. This has been here for 482 days, and I haven't taken one of them. I used to take 2,400 milligrams of ibuprofen every day for 9 months. I'm so glad to. Go figure, I have my MRI done and my doctor appointment on the move-in day for the University of Minnesota. It's crazy busy. Everywhere there is something going on. People moving things, trucking and driving. The traffic's crazy. This is the chaos of move-in day at the U. So the yellow shirt people, they're here to help. They're probably old students. And then the carts are used to fill up students' belongings, right? You can see the housing museum. And everybody's just rolling their stuff in because they need all that stuff to go learn things.
Here's what he looks like.
That's the MRI?
That's the MRI. It goes into that tube about halfway up to about his belly button. Maybe a little more since we're looking at his neck.
Yeah.
And that's about it.
Actually, you show that.
Here's what the head coil looks like.
Cage too.
Looks like he's in a football helmet.
And you said, so there's this type and then there's actually another type too?
The body type right down there that you just put on top of you.
Oh.
Or like this piece is for your neck. So you had both pieces.
If you were doing like
I'll
a
have you hold on to
stabilization.
that. But stand by the door.
Sure. Oh, okay. So my shoulders
So shoulders are right here.
Oh, that makes sense. Yeah.
And then
And that way, it's that's actually like doing a field protection, right?
no,
Around?
actually what it is
Yeah.
the magnet uses sound waves and magnets to get the picture.
Yep.
When you go inside a magnet, this is about 20 times stronger than the Earth's gravitational pull.
Yeah.
So when you go in there, your water molecules in your body,
Are shifting.
they shift one way or the other.
Okay.
They always shift one way more than the other.
Okay.
So what we do is we hit it with a sound wave,
Yeah.
and the sound wave makes it bounce. And when it comes back, because it will always come back to where it was, it gives off a signal.
And that's what you're
And
measuring.
that's what this coil, as we call it, collects the signal.
Oh.
And that's how we get the picture.
Oh. Okay.
And every water molecule in your body, bones, tissues, ligaments,
Respond
tumors, has a different water content.
Yeah.
So the computers are able to break that apart
Yeah.
and give you an image.
So the density of my tumor, if
Makes it show up different than
depending on how its vasal structure is.
The bones and the tissues in your neck, it's a different density than those, so it'll show up.
So if you have, like in this case, I have these hard tumors. They look much different than a soft tumor does in an MRI.
Depends. It depends what its vasculature is.
Okay.
Sometimes yes, sometimes no.
Oh.
Everybody's different.
Yeah.
So
And that's what we look for. So there was a unit that was in my report where it said it was like 2,000 something, and it was talking about the vasal structure in it, which I looked and I looked on
you want to see
PubMed.
what it looks like?
I could never find. Yeah.
Come on around.
Yeah. Oh wow.
We look through.
Look at that.
That's it. There's your eyes.
Okay.
We go through.
And those,
See?
that's
them.
that's
Yep.
the.
Okay, can't show you any more than that.
Okay. Fair enough.